So let me tell you, we would like to welcome everyone to this Impact of Dental Health on Future Medical Complications. It's sponsored by a Coral Protective Oral Spray, and we're kicking this series off with Tom Viola. Now, Tom has, I would say, 5 years because we're not telling his age, but he actually has 30 years of experience as a pharmacist, an educator, an author, and just all kinds of experience. Tom, we're so happy to have you here with us today.
Thank you for having me. This is a great opportunity. I love the opportunity to speak to both of you because I'm passionate about what you do. So thank you for having me.
Well, and I'm going to tell you right now, Tom is going to be talking about a couple of housekeeping things I need to do. And I have my glasses on, everybody, so I can actually see my papers. So you're welcome for that. Yes, these are fantastic. But Tom's going to be talking about the introduction to dental health and its role in preventing medical complications. But before we get started, there's some housekeeping. Everybody clearly knows how to use the chat. That's where you're going to place your questions. I'm going to keep my eyes on that. I won't need them for the chat, needless to say. So go ahead and put your questions in. We are going to be a little time limited, so we'll probably run over a couple of minutes. Any questions that we don't answer or don't get to, we'll send to Tom. Tom will graciously send the responses back, and we'll push it out to everybody on the email. We're also excited to offer continuing education credits for dental professionals, RNs, social workers, and speech and language therapists. The email will come out tomorrow morning with survey, with all the instructions. If you want the CEs, you do have to attend all 6 of the sessions, and they are clearly being recorded. And I also want to make sure that we thank a Coral Spray, Protective Oral Spray, who is again our sponsor for this. And there will be a link in there for a discount code. So I love me a discount. So without further ado, because this is a brief webinar, Tom, let us get started. And so I want to talk about dental health and more specifically dry mouth. So I think a couple of people heard us kind of chit-chatting about it. You heard a little bit about my husband who has dry mouth. There's lots of people that are connected to us, and it's so much more common than I thought. I mean, I just thought it was kind of annoyance, but there's a clinical diagnosis, has a big formal name. Why don't you tell us more about xerostomia? I think that's the way to say it. Tell us a little bit more about that.
That's exactly right. You said it exactly correct. Matt. Well done for a non-dental professional. I give you kudos. Very well done. Yes.
Thank you.
Xerostomia. But, I think the biggest concern about xerostomia from everyone's standpoint, not just the clinicians, but also the patients who have to deal with it every day, is really an understanding of whether or not it's a dry mouth or dry mouth. Because they're really two different things. Dry mouth is something that could be caused by medications. It could be caused by diseases. But a dry mouth can basically be caused by, hyposalivation or a dysfunction of the salivary glands themselves. So that helps us understand, is it dry mouth, a subjective sensation? My mouth just feels dry?
Okay.
Or is it true salivary gland hypofunction, that your saliva just doesn't flow because your glands have become dysfunctional due to radiation, chemotherapy, trauma, etc.?
Oh, I did not really think about it that way. I know, Jay, you're getting ready to jump in. Sorry, guys. This is what we
I'm
do on
like,
our
watch us. We're like, wait a minute, I have a question.
And then what happened?
It's the way it is on our podcast. So I know that our mom has dry mouth, but it sometimes causes excess saliva, which is an oddity to me. But how does this impact mental health and dental health? Like this is what I didn't understand as a layman, because I definitely am not a dental professional.
Okay, so here's the problem. You need saliva to be able to chew and moisten your food and swallow it, right? Mm-hmm. If you can't wet your food enough and it becomes more difficult to swallow, you start making nutritional choices. You start making changes in your diet. You tend to go for simpler to eat things, simpler to swallow things, more liquidy, that kind of thing. So you're talking about less protein, more carbohydrates, more fats, and that's a nutritional shift for your body, okay? That can affect your immune system. At the same time, if the lack of saliva has caused a problem with your dentition, your teeth, and you can't chew, well, again, you're going to go for things that are easier to chew, right? So again, more fats, more carbs, and less protein. So the combination of the two, not being able to chew because the lack of saliva has affected your teeth, and because you really can't wet the food enough and swallow it, you've made these choices now in the food you eat. And so your immunity may suffer. And that can be a snowball effect, because if you have xerostomia and you have periodontal disease, well, now making choices like those could affect your immunity, and that could aggravate the periodontal disease. So it's sort of a vicious cycle. And
Mhm.
at the same time, if you really can't chew and swallow effectively, well, food particles tend to come out of your mouth while you're eating. Uh,
Yeah.
maybe I don't want to eat around other people anymore.
Mm.
So that starts to lead to social isolation, which is, I'd rather eat by myself and not be around other people. And so all of that can affect your mental health, right? It seems like everything around you is working against you now. You don't enjoy food, you don't enjoy eating, you're not in the presence of others that you really want to be in the presence of. And that's why I think while we always talk about dry mouth in dentistry, we don't necessarily always look at the impact it has, as you said, on both the physical and mental health of the patient, including their medical and dental health.
Yeah, I can tell you, I know JJ and I have some questions for you, but I will say, so my husband is a head and neck cancer survivor. It was a HPV related cancer. And one of the things that absolutely happened, we were talking a little bit about this. We didn't know some people were in the waiting room, so you all got a little bit of the early stuff. That's okay. But it absolutely has impacted his ability of his desire to want to go out to eat. I will absolutely, I mean, I can confirm that. We deal with that. He's 2 years outside of treatment and still has significant dry mouth. And we don't know that it'll ever come back. We believe that the salivary glands, the wet part, because there's two types of salivary glands, isn't there? Like a wet part and a sticky part?
Yep, there is. There's serous and mucinous saliva. They're made by different glands, and depending on which glands were irradiated, he may have more of the serous and less of the mucinous. So if he's got more of the serous, it's very loose, and that could, like as JJ said, that can almost be like too much saliva.
Mm-hmm.
That's the other way around. If other glands were irradiated, then he could have more of the mucinous saliva, which is very thick and ropey, and sort of gives you that feeling of taste in my mouth. I don't like the taste at all.
Yeah, and he is nothing but the sticky stuff. And his greatest fear is being by himself eating, and he's afraid of choking. He's afraid, and we've even talked about, are there devices that if something happens, that he's by himself and he's trying to swallow and he can't drink enough, he's at risk of choking. And I think that is a valid fear, which then makes you not want to eat and impacts social quality.
Well, think about it. You need saliva to be able to move the food around to get to your taste buds, right? If you have that saliva to move the food around to get the taste sensation, what are you doing? Well, you're drinking water or soda or whatever you're drinking with it. But now you've diluted the food down in whatever liquid you were drinking with it, and the food just doesn't taste the same. Plus, your taste buds are affected anyway by xerostomia. So it's really a combination of, I'd just rather not eat. And that's very bad, because that means, again, nutritionally you suffer, and your immune system suffers as well.
Everything I've heard you say, Tom, it's interesting because we run into these with our mom who has, like we said, Parkinson's. And it's something that's never been addressed. As many neurologists as we've dealt with for 20 years, we've never talked about dry mouth or these dental issues where she doesn't want to go out and eat. She doesn't want to be around people in public, things like that. So that is really interesting to me. So I have a question. Are there other things that people can take that can cause dry mouth, like dietary supplements, medications, any other substances?
Well, that's the thing, as a dental professional myself, having been in dentistry for all this time now as a pharmacist as well, one of the things that I tend to focus on are all the other things that people can take that can cause dry mouth. And one of the things that I think gets my attention the most right now is cannabis. You've got a lot of young people who use cannabis, a lot of older folks like me that use cannabis, and everyone in the middle who uses cannabis sometimes as a form of medication, sometimes as a form of self-medication. And cannabis, or marijuana as it's known colloquially, tends to cause dry mouth. And so again, I'm using marijuana, okay, and I get this dry mouth, but I'm also oddly, now ravenous for carcinogenic foods and drinks, junk food, soda, that sort of thing, and all of that can really do harm to your dentition. And again, now it leads you down that road where, okay, I can't eat, my teeth hurt, and we go back to where we were before.
Mm.
But nobody looks about that, and no one thinks to look for that in a 20-year-old or a 30-year-old. So it could be a
Right.
family member of yours, a child, or an older child, or even a younger child in their teens, and they've got dry mouth, and they don't really even know it because they're using cannabis, and so they just tend to drink more. But ultimately, that has an effect on everything, quality of life.
Wow.
No, and I think about that. I know that where Jason received treatment, the dental was a key component and still is a key component of his treatment as a holistic view, not just the medical side. The dental is clearly included, as well as the mental health component. And cannabis as a treatment option was recommended. He had asked about it because he was more concerned about the addictive nature to different types of Schedule I medications. And so for him, it was like, well, is it cannabis or do I take hydrocodone or for pain and things like that? And so, but there was yeah, you can go ahead and do that. That won't have a negative impact. But the dental side of the house, and they didn't talk about, hey, this is going to create dry mouth, but these are the extra things you have to do. And this is for medical treatment. You know what I mean? I mean, that was a totally appropriate recommendation. I think it's the extra follow-up.
Absolutely. And think about what it takes now. Let's say you have xerostomia, you're aware of everything we just said. You realize it's an issue in your life. You realize it's causing social isolation. You realize it's causing a change in your nutritional habits. You want to do something about it. Here's where there's a big deficit. What do you use to treat xerostomia? I mean, there are a lot of rinses you can use, but if you're out in public, what are you supposed to do? Rinse, and then you can't swallow it, so where do you spit it out?
Yeah.
A lot of the products that are available are water-based, and unfortunately, that means you don't really get that long-lasting relief. A Coral, the spray that the people that are sponsoring this presentation tonight, there's no bones about it. I like their product because it's lipid based, because it's more of a fat based than a water based, and so it has long lasting relief, which many people can find very soothing, and go about living their life normally versus carrying around a jug of something to swish with every hour and not having anywhere to spit it or know what to do with it.
Well, and I will tell you, if you're trying to combat dry mouth, and Jason is constantly drinking water. So he has thick mucus. When they said rope light, they really meant it when he received his treatment. And so he's constantly drinking water. So guess what happens when you're constantly drinking water? You're constantly peeing. And he has to drink water. He gets up at least 2 to 3 times in the middle of the night. And that is a problem. So we know what happens when the body doesn't get enough sleep. You can't heal. You are going to be more irritable, because I can tell you when he's not slept enough. So I think there's so many extra things there.
Yeah.
What about the fluoride piece? Like, what about like when you have dry mouth, does that impact like dental, like your teeth and all that piece of it? Can you speak to that a little bit?
I sure can, and I'm a bit biased because I've been teaching hygienists and hygiene students and dental students pharmacology for years now. It's what I do, but I'm biased in the sense that I know that the first thing that comes to my mind when someone says they're dealing with suffering from xerostomia is you've got to get into the hands of care. And the best hands of care you can find in this situation are those of the hygienist. The dental hygienist will put you on a frequent recall for appointments. So you'll be seeing the hygienist very often. And we'll be able to establish scrupulous oral hygiene. We make sure we deal with every potential complication. We'll also maybe be able to give you some good saliva substitutes, or in this case, maybe a Coral spray. But also, we'll be able to make sure that we identify any pathology or any problem with your teeth before it happens. And so in this case, you want prevention. You really don't want treatment. It's prevention that matters more. So I can't say this enough, because now, I'm in the dental space, so I always think dental. If you're not in the dental space, You just think your teeth are one more inconvenience that you've got to deal with everything else that's going on. If you've been, let's say you've been diagnosed with cancer, one of the last things in your head is, oh, I better go see my dentist or hygienist. You want to get on chemo, you want to get radiation, you want to get a treatment
Right.
away. But really, the first step should have been to go see the hygienist and dentist, get a lot of this cleaned up, and then move on to your radiation or chemo.
You know, I think that was something that was really interesting to me, because it made sense to me that there would be a focus on dental after it was like, oh, it didn't really occur to me like, oh, we're radiating his head. Like it radiated, like that's where it was squamous cell carcinoma, his lymph nodes there. But there's other diseases too, right? That
Absolutely.
can create dry mouth that have side effects. What are some of those diseases that we should be aware of that are kind of like not Captain Obvious?
Well, okay, so cardiovascular disease alone, right? You've got hypertension. So you're on
Mhm.
medications that lower your blood pressure, but one of the side effects is typically xerostomia. You've got congestive heart failure. Your doctor says, okay, your heart and kidneys aren't working so well, limit your fluid intake. That's another cause of xerostomia. GI, right? You've got GERD. Acid reflux can destroy your salivary glands or damage them. Again, xerostomia, right? There are autoimmune diseases like Sjogren syndrome that can damage your salivary glands. Even things like anxiety and depression, when you take medications to treat those, that's more xerostomia. Even dental procedures can damage salivary glands and or the nerves that supply the salivary glands, and that can cause xerostomia. So again, it goes back to the same situation we said before. The first step is really identifying what's causing it. Is
Right.
it truly dry mouth or is it a dry mouth? And then that from that strategy, a dental professional can help you figure out the best method of treatment.
Mm.
So here's my question because I have to say it's all about me. So here it is. So we're caregivers for our mom, and we've fought whether it's dry mouth or it's excess saliva. So when I go to the dentist, when I take my mom there, and she's a Parkinson's patient and has been for 20 years, how much medical history should I be telling them? But how much should they be asking me? Like, how much of her background does a dentist need to know?
Everything.
Really?
This is the hardest part about dentistry and medicine. And I'm not ashamed to say that even I, in my 30 years being involved in the dental space, can tell you there was a time when we viewed patients as dental patients and medical patients. Even though it was the same person, we kind
Yeah.
of put it in our sphere. Okay. They were a dental patient, but they were also a medical patient. And what's happened over the last 30 years is this convergence of dentistry and medicine when we realized they're not two separate spheres now. They're one. We instead of siloing, we have to look at it as, okay, this is one person. And there is this oral systemic connection. What goes on in the mouth can affect the body, and what can affect the body can go on in the mouth. And I just got really lucky because I ended up being the pharmacologist in dentistry. And I saw that as a dental professional these days, you've got to be an expert in the medical side of dentistry, but also the dental side of medicine. You've got to be able to see that convergence. And the only way you could see that is if the patient gives you everything. I've often said this to dental professionals. You've got to know that patient like you know a family member. But from the patient standpoint, why do I need to tell you? You're working up here.
Yeah.
You don't need to know everything about me. You're just working on my teeth. And that becomes a bit of a barrier as well.
You know, I keep thinking about I feel like you talked about prevention, and prevention is such a big thing, whether it's in mental health. We want to do preventative services to really support individuals in medical, the physical health side. But you're right about the dental, because I've heard lots about co-locating between mental health and physical health or primary care, but you
Yes.
don't hear about dental co-locating with primary care. And it almost feels like we should have all of the medicine people all in the same building, and you've got teams, a true multidisciplinary team to be able to support individuals, regardless of if it's a complex health issue, a chronic health issue, individuals with disabilities. I can only imagine being able to identify dry mouth. This isn't even on our list of questions. Identifying dry mouth in individuals with intellectual disabilities or who are nonverbal to be able to say that. So what are some of the things for our caregivers and parents and professionals on working with individuals who may have limited abilities or intellectual disabilities or even being nonverbal?
So if you're the caregiver, you are the most important person in that person's life, right? You're their olive branch to the rest of the world, right? They may have issues that not everybody understands or is accepting of or even really has awareness of. But you're that person that is their liaison, that representative. But at the same time, as you're the representative for that person to the outside world, you have to represent that person's interests when it comes to those other people in the outside world. And you've got to sometimes explain, hey, I get what you're saying, but now we're going to go home. We're going to try to implement that. And we may need some resources from you. We may need some extra training. We may need some advice on how to make that happen. So, for example, with a patient with Parkinson's disease, go home and brush those teeth and make sure you floss. Okay, but for a person with Parkinson's disease, they may not be able to even hold the toothbrush tightly enough to brush or
Right.
have the dexterity to floss. So you need to do that for them. And that's where you become the valuable person.
Mm. I'm getting a whole bunch of comments from the chat. So if you guys
I
aren't
know.
also watching the chat at the same time, I'm like, oh, that's a good point. Oh, that's a good point.
I know.
I love it. I think that's so important. I want to kind of go over here to the chat, Tom.
Yeah, sure.
Someone said, I can't see the whole thing. It's Marg right now. I'm whoever Marge is. Marge, you're my bestie right now. So it says, so what do you suggest for our patients do? Rinse, it says rinses are not great, especially mint and alcohol have this burning sensation.
That's true. Yes.
So what are some recommendations maybe that you could offer?
So I like a coral. I mean, not because I've worked with them in the past, but because I just think it's probably the most effective aid we can use for xerostomia. Because first of all, it's very discreet. If you're my age, from my generation, I look at it as like Banaka, a little spray that you stick in your pocket, but it's a lot smaller, and you just spray it, and it coats your mouth with this lipid base made from corn oil that really keeps your mouth moist for long periods of time. You don't need to spit it out. You can use it very discreetly and stays in your pocket the whole time. So I like it because it provides that long lasting effect that people need versus having to try to rinse every hour or drink water every hour. Because as you said, Nat, very well put, the more water I drink, the more I have to urinate. And ultimately I'm going to say, you know what, I'm not going to drink anymore.
Yeah.
I'd rather have dry mouth because I can't, there's sometimes when I can't urinate, if I'm on a golf course or I'm in a supermarket or I'm out shopping or just walking around, a restroom isn't always immediately available to me. So that's why I like that. I think that's probably the first way to go for an active lifestyle. But also, I think it's important to see your dental professional, see your hygienist as often as possible. Keep everything working very well in your mouth. Follow the protocols and procedures they give you for home care. And keep in mind that things are going to pop up. It's not always going to be so easy.
Yeah.
So when things pop up, it's important to seek help. Now, keep in mind, I've been talking about dental professionals, but we can't ignore the fact that you do need to see your medical professional as often as well. So schedule frequent appointments, make sure you're compliant with your appointments so that if there's any change in your condition, it's like you said before, now it's that integration, as I said, but you said it even better. I wish we were all in the same building. I wish we were all in the same room because it's really a multidisciplinary approach.
Yeah, I think that's so important. There was a follow-up question about over-the-counter script for a quarrel. It is a script right now.
That is correct.
And we'll make sure that folks have in the email that we send out tomorrow, we'll make sure you have all the details of about a quarrel, it being lipid-based versus water-based, and there's pros and cons. I have Melinda who just asked a question. Any recommendations for nighttime dry mouth? I wake up with mouth pain and my tongue is stuck. I use a CPAP. We didn't talk about CPAP.
We did not.
That was my question. I was like, is is there equipment? Tell me about
Yeah.
that. See,
And she's using Biotine, but it only lasts about an hour. So this is, and please know, we're not bashing anybody. We're not saying, like, there's lots of solutions, but a coral is a really good an alternative to water-based. I think it's, you got to know your stuff to know what you want to try. So what would you recommend for nighttime?
So this is important because anyone who's ever suffered nighttime dry mouth knows the best solution is keep water by the side of your bed, right? Okay, but you're fumbling around in the dark, you're trying to reach for the glass, you might knock it over, you might spill it. So one of the things I recommend is if you're going to drink during the night, make sure you have one of those like water bottles that you can open and close relatively easily. I've even had some patients actually wear a hydration backpack to bed so they can keep the tube close by, take a sip, and just go right back to sleep because you don't want to obstruct your sleep any more than you have to because you're waking up constantly for mouth moisture. A coral will be a good solution for nighttime because it'll keep your mouth moist longer than any of the other products that are available. But again, Biotine has its advantages too. So if I'm home during the day and I don't want to use a coral and I want to like rinse with Biotine, that's fine. It's really a balance you have to find of how long you want your mouth to be moist. And for the longer stretches, like bedtime, sleeping, during the day when you're out and about, I think a spray like a coral works. If you're home and you just want to keep your mouth fresh and feeling and tasting good, then maybe use something like Biotine or another oral rinse. But it really has to work for you and your lifestyle. That's the most important thing I could tell anybody who's listening. If you're the person, the patient themselves who's dealing with xerostomia or their caregiver, you've got to know what works best for them and be adaptive to that and say, okay, we're going to use a multitude of different products or several products to really attack xerostomia from several different directions.
Well, and I see that there are a couple of folks, and I apologize because people are in the chat. We probably should have told everybody to change the to button to everyone, but that's okay. We'll get that on Thursday. So I'll make sure I get everybody. Some folks have recommended Xylomelts. We've tried those. We use a combination of tablets. I mean, honestly, folks, I have my purse full. My husband just puts all of his stuff in it, and it's like he's trying what works, especially because he has severe dry mouth. It is constantly, it never goes away. So let me ask you one more question. I know, we're getting so close to the end of time, and I wish we had an hour. We love you, Tom.
Okay.
So
You guys too.
tell me about frequency of brushing. If you have dry mouth, should you brush after every meal? Because I'm thinking about if it's dry and you don't have enough stuff to get all the sugar and the stuff all the way down in the bucket. So what do you think about that?
Yep. So toothpaste itself can be nerve-wracking for somebody with xerostomia because you need enough saliva in your mouth, first of all, and you're trying to rinse all the toothpaste out, but some residual stuff's left behind. And now that can actually add to the ropiness or the thicker saliva, if that's what you're dealing with. Leaves your mouth minty tasting, but that can be almost to a fault. Plus, if you've got some type of salivary gland hypofunction or some alteration to your taste buds, what tastes minty to you and me may not taste so minty to them. So again, one of the reasons why I'm glad to be on this with you both is because you're caregivers, and I don't think we give caregivers enough support and enough reward for what they do and enough encouragement, and I think that's what's lacking. So if you're that person's liaison, if you're that person's olive branch to the world, you've got to be able to say, okay, toothbrushing might be great for everybody, but let me go speak to the hygienist or the dentist and find out exactly how often I should be brushing and what I should be brushing with. And that way, I think you can get a better sense of oral health care. In my opinion, I think we should be brushing and flossing after every meal. That's not always practical.
Right.
And we recommend that for patients with respiratory disease. When you use your inhaler, okay, rinse, but as soon as you get a chance, brush and floss. Well, how many people do you know who use an inhaler and then brush and floss almost immediately? I travel a lot, and I can tell you a lot of people eat on the road. I don't see many people brushing and flossing in the airport bathroom. So it's
I'm one of them. I am totally guilty. I mean, I'm not going to lie to you. Jason brushes 3 times a day. And I will tell you this, and folks, this is it. And I always want to give lived experience. He uses 2 types of toothpaste. He has to use toothpaste at the end of the night that has fluoride to try to protect that mouth. And he uses a water pick to get anything there because they have sufficiently scared him enough to say, if you have cavities, if you have to have something pulled because of that radiation to that mouth area, it could be very hard to heal. And so that's why I'm like, the more kinds of options we want to talk about, the better. That's why it's like, there's lots of solutions. work with your dentist. What I hear you saying, Tom, is work with your dentist to find the solution that works best for you.
Your dental professional is the most valuable resource and the most valuable person when it comes to your teeth, your dentition. You've got to make sure you schedule frequent appointments. And if you're the caregiver, you're with them every step of the way. You're listening, you're taking notes, you're understanding what the instructions are, because much like, you're going to take care of your own teeth, you're now responsible for their teeth as well. And a smart person once told me, you can live a long life, but the two things you need the most in this life are your teeth and your feet. And I've always said that, those are the two things that matter most because they affect your quality of life probably more than anything else, the things we take for granted. Right?
All right. Well, I'm going to tell you right now, Tom, we love you. We are having you back at some point. I'm telling you right now, friends, it is the end of our time. I have to be respectful because Tom is in high demand. So we will make sure you guys have Tom's contact information. I can't thank you enough for sharing your wisdom. I also want to thank our sponsors, Coral, all of our partners. Guys, you'll see that. And then don't forget, you're going to receive an email probably tomorrow morning. It's going to have all the information about CEs. So for, again, what we talked about, this is recorded. We will make sure the recording goes out to you guys. Somebody had asked about that. Yes, you will get the link for that. So you'll have an email that has CE information, the survey for the session. Would love your feedback. Besides, do a longer time. Respect that. And a discount code for a Coral spray because we totally believe in that. We love it. And there's a lot of products, but we definitely want to thank our sponsors of Coral for this. And of course, tell your friends because it's not too late to register. And they can jump right in and folks will have access to the videos so they can catch up. And that way they don't have to feel bad because they missed Tom because they didn't know. JJ?
Well, and we also, in your email that you'll be receiving, we will make sure that if there are different directions for getting on Thursday night when our next session is, we'll make sure if you had any problem at all, we'll get that corrected. So tell anyone out there if they had a problem, just watch for their next email. But we do have our session number 2 on Thursday night, and that is with Dr. Alessandro Villa. And if I pronounce that right, we mess up everybody's name, Natalie,
You don't mean to.
But his session is the influence of medical treatments on dental health. And that is a deeper dive into the challenges for cancer patients. And we're looking forward to this session. So we hope to see you then.
Thanks, guys. Thanks for joining us.
Thanks, everybody.
Bye.